با درود و سلام خدمت همه شما بینندگان عزیز تلویزیون جهانی کانال 1. با برنامه دیگه ای از برنامه طلوع در خدمتتون هستیم با تازه ترین های پزشکی. مهمون این هفته ما یکی از متخصصین دندان پزشکی و ارتودونتیست های خیلی بنام در شهر بیورلی هیلز ایالات متحده هستند که تازه ترین درمان ها و اپروچ ها در ردیف کردن دندان ها و تریتمنت های ارتودونسی رو برای ما خواهند گفت. ایشون همچنین برای وبسایتشون میتونید به www.drprero.com مراجعه بکنین. Dr. Dovi Prero is a board-certified orthodontist in private practice in Beverly Hills, California. He completed dental school at distinguished UCLA, a master's degree from La Jolla University, and his orthodontic residency at distinguished USC, along with a master's degree in craniofacial biology. In just 6 years, Dovi has grown his practice through quality treatment outcomes, cultivating referral, relationships, and social media marketing. He is a Diamond Plus top 1% Invisalign provider, one of the youngest doctors to achieve the highest recognition from Invisalign. Dovi lectures nationally and internationally on Invisalign treatment, the use of the iTero intraoral scanner, and social media. When he is not in the office, Dovi enjoys spending time with his wife Naomi and their 3 children, Eliana, Alexandra, and David. Welcome, Dr. Prero. Thank you so much for accepting my invitation.
Of course, I'm so honored to be here with you today.
Thank you so much, Dovi. First of all, I want to make it clear I have been in communication with many dentists, both professionally and personally, during my life. And I want to say that you are one of the best and brightest, both inside and outside, professionally, scientifically, and bedside manner.
Thank you so much. That means a lot to me, from you especially.
Sure, thank you so much. Dovi, I would love to ask about the COVID, which we are at the hottest subject, which is pandemic. How COVID has been affecting your practice? Have you been having any downturn in your practice?
So it's a good question that you ask. When we first started with COVID, it feels like it's forever ago, and I feel like it's been on this train that's gone up and down. And when we first started, we didn't really know how it was going to practice. And so we took, like the state had mandated, we took the 2 weeks, which ended up turning into 2 months from the California Dental Association recommendation. And then since then, at that point, we didn't see any new patients. We only saw like some existing patients and maybe some patients just over Skype, things like that. And then after two months of complete shutdown, we actually reopened, and we saw a very interesting phenomenon. We're here on virtual consultation using our software, and a lot of people have been using Zoom for school. And what we noticed was this Zoom phenomenon. What we think about normally is people are looking at their teeth, maybe once a day, they look in the mirror, they brush their teeth, or they take a photograph, they see it. And why I call it the Zoom phenomenon is because we had all these adults that all they were doing all day is just looking at their own teeth. Like we're doing now, I can see myself on the screen, you can see yourself, and other people can see themselves. And so they noticed the whole day they were looking at their teeth. And not only just a static picture of their teeth, because when you smile, sometimes the lower teeth don't show, but actually when you talk, your lower teeth show also. And so we experienced this, what I call the Zoom phenomenon, that we had, once we opened up, we had even a greater amount of interest. And I think also it kind of set the tone, being that we were in a pandemic, that people decided to refocus on themselves and to be able to do something for themselves because we didn't really know what was going to come the next day. And we also saw that a lot of adults, it's always the case that parents always take care of their children. You take care of your daughter 100%, no matter what she needs. But we noticed that normally adults that didn't necessarily have time, that were busy lawyers or accountants, that had 8 to 5 or longer jobs, didn't have the time to come, drive to the office and then see the doctor and then leave. And then with Zoom, we had a lot of patients that actually would just continue their Zoom in the waiting room until it was time for the consultation, and then they'd see us. So it ended up being a huge boom in the practice. I think in general, people prioritizing what was important to them, and then also the convenience of being able to see the doctor on your own schedule.
Wow. Sounds that you have been having boom rather than isolation.
Yeah, our practice grew. We had to hire some more people, and then this year, I always think there's what we call pent up demand, which means that, of course, some people couldn't get in for those 2 months, but then we're a year and a half after this, and we're still experiencing that, and so we're riding the wave, and I think trying to be accommodating to the patients all throughout.
Excellent, fabulous. I want to ask a question. Tell me about your practice, Dovi.
So I started my practice here in Beverly Hills in 2014, about 6 or 7 years ago, at the tail end. And when I started, I first rented a chair from another doctor. And this is, I would say good advice to other doctors that are looking to grow a practice, is you can find a way to start in the location where you don't really have too much overhead. From a business perspective, starting where you're just using another doctor's space and paying them for it. And so my practice grew from 1 day a week, I rented a chair, to 2 days a week. And then I combined my practice with another doctor's who was retiring. And then just a few years ago, I purchased the practice across the street from me and moved into it. So I always only had one practice. And throughout the process, in the beginning years, when I wasn't busy in my own office, I would be there for a couple days and then work in a more corporate style office for other doctors. And then as my own practice grew, now I'm here 5 days a week.
Wow, sounds smart and exciting.
Yeah,
What types?
it was slow and steady, and it was just logical for me at that time.
Exactly. What type of braces do you offer?
So it's a great question. I would start out by saying that we like to see patients. We have really two categories of patients. We have adult patients. They know they need something. They're coming in and they want something that's going to look nice and not get in the way of their lifestyle. We also have children on the younger age who may not have all their adult teeth in yet, but still need to be checked out. And so I usually recommend patients to come at around 7 or 8 years old. It doesn't mean that we start right away, but it does mean that I get a baseline. And you know how important it is to kind of get a baseline of where the patients are right now, and then we can see them on a yearly basis and then choose the right time that's best for them. And so the types of braces that we offer is we offer the traditional metal braces. Some people actually come in specifically wanting those. You would think that who would want metal braces? They tend to stay a little bit cleaner. And also sometimes adults who never had the opportunity, if financially they didn't have the opportunity when they were younger, so it's kind of like fixing their way they grew up, and it's like, oh, they can never afford the braces, and now they actually want them. So that's number one, is we have clear braces. Number two, we have that was metal braces. Number two, we have clear braces. Clear braces is just as effective as the metal braces, but they're clear. A lot of adults like them because they blend in, but the braces themselves don't stain, but they can cause a little bit staining around the teeth during treatment. And so for those reasons, patients and many others, most of our practice is Invisalign. What is Invisalign is a good question that a lot of people ask, and are you a candidate? Most of our patients are candidates for Invisalign, and the reason is because the technology has evolved and the doctors have gotten more talented at using the appliance to treat. So Invisalign is a series of clear trays, and it goes on. Almost everybody in the world now knows what it is by name. And slowly but surely, it moves the teeth. So there's a series of clear trays. We might have, 10 or 20 or 30, and you switch one a week. And so you switch them at the comfort of your own home. And the benefit of it is that it's clear, and you can get your teeth straight without people noticing it. And then in addition, you can take them out, and there's no food restriction. You can eat whatever you want. And then also, it's so easy to brush and floss. So some of our patients who either have a little bit harder time, or especially maybe older patients that need to take care of their gums better, Invisalign is a great option. And then the final option that we offer is braces on the inside of the teeth. Those are very, very popular. And patients who choose them essentially want the benefit of braces where we're doing the work for them, but don't want them to be seen. And that works really well. And those we use the company that we use is called Inbrace. Inbrace is a really great company. It was founded by my classmate at USC and UCLA, and they work beautifully. And so it's a great option for another aesthetic way to do it, but without patients having to see it and without having to wear anything in and out. But I will say that most of our office, most of our adult patients, and most of our patients in general is actually Invisalign, and they find us all over the place. They find us online, they find us from their doctor, because I'll remind our audience is that you actually don't need a referral in order to see an orthodontist. If there's something that you want to prove about your teeth, you just look up online, you find the doctor that has a good reputation, and then you can make an appointment. And so most of our patients don't have a referral, and almost all of them qualify for Invisalign also.
This is terrific. Dovie, what has changed recently?
I would say when you talk about the technology that we have in the office that wasn't here even just 5 years ago, the thing that's the most convenient, or just about 5 years ago, is number one, intraoral scanning. Intraoral scanning is where we actually use a little machine to record the mouth instead of using the Play-Doh material or the clay material. It's convenient, it's faster, it's more accurate, and it allows us to get whatever we want to order, a night guard, a retainer, a crown. All of those things we can order very quickly, and it's very convenient for the patient. So those are some of the reasons why we've incorporated this technology. It's called the iTero scanner. And I speak for Invisalign about the iTero scanner and how we use it in the office. And we have 3 of them now, and we've had it for just about 5 years, and it's been a tremendous technology to the practice. It also allows us to visualize to the patient what it's going to look like. So they can come in and they can see a visualization of, oh, what is my smile going to look like if I were to do treatment? And then we can show them. And then it's very easy for them to sign up because they know what they're going to get, which is, I love that part, the transparency. And then I would say also 3D printing is a new technology that we've incorporated into our office. 3D printing allows us to take that scan digitally and then print it right here at the office. And then we're able to make the teeth exactly the way we want, or the retainer, and that's something that's very, very convenient and is continually evolving. And that's why, orthodontics is so exciting, because the tools and technology that make it for better care and more comfortable care is something that I enjoy a lot.
That's great. So it sounds to me you use customized treatment option, right?
Yeah, that's a very good point. With the technology that we have, we're actually able to order the braces so that they specifically match the teeth that we're getting, whether it's on the outside or the inside or the Invisalign. Everything can be custom. What's nice about custom is that it fits better, and then the treatment is faster. And so patients absolutely, they love that portion of it. And it's very satisfying to know that we can, a lot of the technology is based on the previous science, but knowing that we are pushing the ball forward so that ultimately the patients benefit from it.
Great. Dovie, I'm curious to see have you ever seen any patients that have tried to straighten their teeth at home? That
is surprisingly, it's a very hot topic nowadays. So so there are a lot of different companies that will send you something in the mail, and then you send it back, and then patients have tried it. Now, mostly the reasons why patients try it is, I really believe that it's not so much the financial, because it is cheaper to do it at home, but I think they're very intrigued by this concept called DIY, or what we would call do it yourself. This whole concept of having a YouTube channel or going onto YouTube to seeing how other people design their smile, and how other people do anything around the house. So it's very cool, and people like taking a part of it. The thing is that you only have one set of teeth, and so when you only have one set of teeth, if you mess up with that, it can mess up your bite. It can mess up your gums, the bones, the health of the teeth, the roots. And so that's why I discourage it. And actually, we see in my office about one patient a week that has tried it. And either it's not been effective for them at best, or at worst, it's actually hurt them with some irreversible damage. And so we try to educate people, but the one thing that these companies are very good at is marketing. And so they get the word out. And so ultimately, it hasn't affected our business, but I care more about the patient, and it has affected patients in general. But luckily, usually it's not so bad that it can't be fixed, but it has to be attended to usually right away. So I would encourage patients to watch out from those models and just see a doctor, see an orthodontist, so that your teeth, like I said, you only have one set of teeth. If you get a bad haircut, you can, the hair will grow hopefully, and you can get another haircut next month. But if you mess up your teeth, you only get one set after the baby teeth, of course.
That's absolutely true. Any new things about Invisalign?
Yes, so we have a lot of innovations with Invisalign. A lot of what has made our Invisalign successful is the way I design it. And the way I design it allows so that I customize. I tell people, like, Invisalign is kind of like a printer, that prints the paper for me. But imagine you were writing an essay. It would all have to do with how you wrote it or how you typed it yourself and the words that you chose. So being kind of like the author of the smile. And so through that, we're able to design the smile based on the courses that I've taken, or the courses that I've taught to other doctors, and using my broad background in dentistry in general and orthodontics in specific. And so those continually evolve. And in addition, the aligner material gets better, and also the way the interface between the aligner, which is the tray that sits on your teeth, and the teeth on the attachments to the teeth, that also improves. So over time, almost every year, the technology gets better, and that just means better treatment for our patients. Thank you.
Do you do digital impressions?
Yes, so that's the iTero scanner, which our patients love. We take it in the office, and then the patients are able to order anything that we would need from it. And very often, moms or dads will come in and say, "Oh, I want that too for my retainer or my night guard." And so that is a very convenient way to take any model of your teeth, really. So I love it, and that has there's a new model out now, actually, called the iTero 5D, the Plus series, and that actually is starting to show the inside of the teeth. So we can actually use that instead of the radiation for the dental x-rays, which is very healthy, safe, and also very exciting too.
Wow, thank you so much. Do you have 3D digital x-rays?
Yes, in my office we have the 3D digital x-rays, and so that is a technology that allows us to check the health of the roots and the teeth and the bone, and then it really gives us an automatic picture of what the teeth look like. And because it's 3D, there's no more distortion about where the teeth are, and we don't have to take one x-ray and then another. We can get it done all in one shot, so it ends up being less radiation for the patient. And it shows us from the side view. You can actually cut it any which way in order to see the teeth, which is really wonderful. So it's a technology that we invested in at the end of last year, and it also, some doctors have it where they actually will send you to another office to take the x-ray. And in my office, we have it all there, which makes it really easy and convenient.
Exactly. It seems that you have all in one place. So that's really great.
Yes, that's the goal.
I know that you are crazy busy. Very much I thank you for the wonderful information you provided. Thank you so much again for accepting my invitation, and we would love to have you again with the most novel informations and approach in orthodontic treatment. Thank you so much, Dovi. So many thanks.
Of course, I look forward to being on again, and I appreciate the opportunity to share with everybody.
Sure. Thank you so much. Have a wonderful day. بله، ما مطالبی رو که آقای دکتر پررو گفتن، ایشون کووید آفیسشون رو، آفیس اپروچ های ارتودنسی رو نه تنها خلوت نکرده، ظاهراً با توجه به زوم اینها تعداد بیشتری از مراجعین رو تونستن همزمان داشته باشن. ایشون اشاره کردن به تجهیزات مختلف و جدیدی که در زمینه درمانهای ارتو به کار گرفته میشه، مثل 3D پرینترها که میتونن برای هر فرد درمانها و قالبگیری‌های ویژه خودش رو داشته باشن. و همینطور اشاره کردن به نکته جالبی در مورد درمان‌هایی که این روزا تبلیغ میشه، کمپانی‌هایی که توی خونه ادعا میکنن میتونن انجام بدن درمان‌های ردیف کردن و ارتودنسی رو برای بیماران و متقاضیان. ایشون نظرشون این بود که این خطراتی ممکنه داشته باشه، آسیب رسانی به لثه داشته باشه، مثل کوتاه کردن مو نیست که مو رشد بکنه بجاش. این دندون‌ها اگر به طرز نامناسبی بدون سوپرویژن و صلاح دید پزشک در خونه انجام بشه، ممکنه پیامدهای آسیب رسان و ساید افکت هایی داشته باشه که جبران ناپذیره. بنابراین توصیه کردن حتما از کمپانیایی که استفاده میکنید تحت نظر یک متخصص ارتو و یک دندون پزشک باشه. و ایشون اشاره کردن که به درمانهای مختلفی که میتونه به عنوان ردیف کردن دندان برای هر فرد به صورت ویژه استفاده بشه. خیلی ممنون که بیننده برنامه ما هستید. برنامه ما هر سه‌شنبه ساعت 6 بعد از ظهر به وقت غرب ایالات متحده، همزمان با 5:30 صبح در ایران، با تازه ترین اطلاعات پزشکی خدمتتون تقدیم میشه. تا برنامه بعدی، روز و روزگار خوش.